Hello, my name is Doris and I'm majoring in health studies. I completed my fieldwork at the Public Health Agency of Canada as a student analyst, but before I start on my special project, I would like my supervisor Kyle to give a quick introduction of the agency.
Hello, I'm Kyle Simons at the Public Health Agency of Canada. At PHAC, our mission is to promote and protect the health of Canadians through leadership, partnership, innovation, and action in public health. Our key program areas fall into three main categories. One is health promotion and chronic disease prevention. The other is infection disease prevention. And the other is health security.
Thanks, Carl. Now I will talk more about my special project during my time at the Public Health Agency. My special project is a research project titled Substance Use and COVID-19. I chose my special project because of my interest in issues such as substance use and vulnerable population. Due to the current pandemic, public health restrictions such as social distancing have created major challenges for vulnerable population, particularly for individuals who use substances. I work at the Regional Emergency Coordination Center at PHAC, which has become mainly activated due to the pandemic, as their goal is to help reduce the spread of COVID-19. Due to my interest in individuals who use substances and the organization's interest in COVID-19, I was able to choose my special project. I became familiar with the organization in January, and by February I handed in my first draft. Although I had a lot of responsibility, I managed to hand in my first draft to the supervisor and PHAC analyst on time. My initial plan was to conduct analysis that focused mainly on Saskatchewan. However, I found it difficult to find sources that only cover Saskatchewan, so I needed to expand all my searches to country and the province. I also needed to make adjustments to some of the language used throughout my project to reduce stigma against vulnerable population. Instead of using the word drug addict, I replaced it with the word people who uses drug. One thing I would have done differently is to understand the role language plays in creating stigma. This project has been a success because I was able to come up with various evidence that proves how people who use substances experience challenges due to COVID-19 and needs measures. For example, an interview by the Canadian Centre of Substance Use and Addiction explained how people were given a weak supply of methadone that may be used in isolation. Although this is a good initiative to reduce the spread of COVID-19, it can potentially increase the risk of overdose or misuse. This project has helped create awareness to my supervisor and others at the agency on how preventive measures also create additional challenges to certain population. It helps the organization make informed decisions while also engaging with other stakeholders or when dealing with cases surrounding substance use. I was also able to provide some valuable recommendations to the organization while also assessing best practices that other organizations have taken to minimize these challenges. During this project, I utilized tools such as Chief Public Health Officer Report and PHAC Health Inequality tools, and now better understand the link between social determinants of health and the impact of COVID-19 on substance users, such as issues related to economic security and employment conditions. It also helped improve my professional writing skills. Overall, this project has helped my research skill, critical thinking, and my community.